This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
Colorectal cancer is the second leading cause of cancer death among men and women combined in the United States. And hearing that you have cancer can be a frightening experience. But one way to reduce your fear and anxiety is to learn about the condition and your treatment options. So, what do you need to know about colorectal cancer and the treatment options? Let's find out with Dr. Nadir Edmond Adam, a dual board certified general surgeon and colorectal surgeon at Dignity Health. Dr. Adam, thank you for your time. So first off, can you explain to us what is colorectal cancer?
Colorectal cancer is a malignant tumor of the colon and the rectum. And by malignant tumor, we mean a tumor that can spread outside of its origin. If it is in the colon, it can grow more and can go to the lymph node outside the colon or even to the distant organs, to the liver, to the lung, or to the brain.
So that's why it's really good to catch it early, right?
That's why screening for the colorectal cancer is important, because this is how we catch it early. And actually, to catch the source of it, in most of the cases, will be the polyps and the colon. This is why screening for the colorectal cancer is highly recommended, since the colorectal cancer is a common tumor, and if caught early, the survival is more than 90%, 5-year survival more than 90%, while if it's caught late, like in stage 4, the survival drops to 30%, 5-year survival 30%.
So those figures are quite startling. So let's stay with screening then. What types of screenings are available?
So screening for colon cancer is recommended for age starting at 50 years old or older, or earlier than that for certain conditions. When there is a positive family history of colon cancer, it should be started 10 years before that, or if there is precancerous conditions already with the patient, like ulcerative colitis or colon polyps. Now, for the screening colonoscopy, for screening test, we have the stool test, which include the fecal occult blood and the Cologuard. The difference, fecal occult blood, they test for the blood and is recommended yearly. Cologuard is testing for the abnormal DNA material in the stool and is recommended every 3 years. If both those tests or one of them is positive, patient should undergo the gold standard screening test, which is colonoscopy. The other screening test is sigmoidoscopy, which is limited colonoscopy, just limited to the left side of the colon, which is the site of the cancer in more than 50% of the cases, and that should be repeated every 5 years. Now, the next one is the barium enema. If we are doing the sigmoidoscopy, we have to do the barium enema to visualize the whole colon, and that's also every 5 years. Again, if the barium enema, any abnormality in the barium enema, patient should go to the gold standard screening test, which is the colonoscopy. Now, the next screening test is the gold standard, which is colonoscopy. Colonoscopy, meaning visualizing the whole colon. It will need bowel prep and special preparation. Usually it is done under conscious sedation, sometimes under general anesthesia, it depends. And during the test, we'll visualize the whole colon, remove any polyp, take any biopsies that needed during the colonoscopy. If the patient cannot tolerate colonoscopy, there is a last one, which is the CT colonography, which is using the CT scan technique for examination of the colon by insufflating air in the colon and visualizing it through the CT scan. Again, if the CT colonography is positive, colonoscopy is highly recommended. So in summary, the gold standard is colonoscopy whenever is possible.
Right, so many different screening options are available. So as a person that's had a colonoscopy, I urge you, as Dr. Adam has said, the colonoscopy is the gold standard. Do the gold standard. It's not that difficult. Get yourself a colonoscopy. So, Dr. Adam, let me ask you this. Are there any symptoms that are involved with colorectal cancer at all?
We don't like the patient to wait for those symptoms, because when the symptoms appear, it means the disease is there. The screening is still the gold standard. So whenever there is a positive family history of colon cancer, I urge everybody to go and start seeing a surgeon or general surgeon, at least to get more information when I should start screening. For the average people, they should start at 50 years old. Now, for the symptoms, we have seen cases with the symptoms that they come. The alarming symptoms is blood from the rectum or bleeding from the rectum. The other one is altered bowel habits. Somebody that with usual bowel habit and then starts to have, I am constipated. I have difficulty with the bowel movement. Lower abdominal pain is less, also can be a symptom. The other things is if the patient start to be more like easily get tired, what we call anemia, because colon cancer, the left colon, if they bleed, they will cause bleeding per rectum. The right colon, if they bleed, they will cause anemia. So those are the most common symptoms that should be drag attention for the colon cancer. But again, I will say screening and prevention is better than the symptomatic cancer.
So if someone is experiencing bleeding, is that when they would see a general or colorectal surgeon?
Any bleeding per rectum should be evaluated by general surgeon, or to be more specific, by colorectal surgeon after patient is evaluated by his primary care provider. Because hemorrhoids can be there, but still the cancer can be there causing the trouble. So if there is a hemorrhoid and with bleeding per rectum, it's wrong assumption to make that the hemorrhoid is the source of the blood. Still, I encourage the patient to ask the primary care provider to be referred to colorectal surgeon for further evaluation.
What about treatments for colorectal cancer? Can you explain those to us?
Now, treatment of the colorectal cancer, once we diagnose colorectal cancer, and I mean by the diagnosis is a biopsy. After biopsy, we go to the second stage and it is all the treatment or management in general. After the diagnosis, we'll go to the staging of the cancer. And by staging, we mean how far is the cancer grown already. Usually, we divide it to 4 stages. Stage 1, when it is early colon cancer, the cancer is still only in the wall of the colon. Stage 2, it is deeper in the wall of the colon, but did not involve the lymph nodes outside the colon. Stage 3, when the cancer involved the lymph nodes outside the colon. And stage 4, which is the most advanced one, when the cancer involved distant organs like the liver or the lung or the brain. Treatment of the colon cancer, we have 3 modalities: surgery, chemotherapy, and radiation therapy, especially for the rectal cancer.
Okay.
Which one we start with? It depends on the stage of the cancer. For the early stage cancer, we start with the surgery. And surgery, it can be resection or even can be endoscopic if it's very early cancer in a polyp that can be removed through the colonoscopy, and we do surveillance after that. That's also acceptable. More advanced cancer, stage 2, no, it needs resections to evaluate for the lymph nodes. If it's more advanced, like locally advanced cancer, sometimes neoadjuvant chemotherapy, which means giving chemotherapy in advance before we doing the surgery. Sometimes we do neoadjuvant radiation therapy, especially for the rectal cancer, to shrink the cancer, downstage the tumor, and then do surgery. They found that the recurrence is less with that policy. So in general, we have surgery, chemotherapy, radiation therapy. Combination of those 3 factors is what to start with. Usually, we encourage that good communication between the surgeon and the oncologist once cancer is diagnosed for planning of the treatment.
Dr. Adam, if you could wrap this up for us, give us your final thoughts on colorectal cancer.
So here's the thing. Again, prevention. The best treatment is prevention because colon cancer is completely preventable disease. screening for the colon cancer through the colonoscopy is possible and can be done. I will not say easily, but can be done. It needs to be done after the age of 50, and if it is negative, every 10 years. If it is positive for polyps, it depends. How many polyps? 1 to 2, the colonoscopy should be repeated in 5 years. If it is 3 plus, then the colonoscopy should be repeated in 3 years. And now, if it is a polyp that is bigger than 1 centimeter or certain type of pathology we call adenomatous polyp, then we might repeat the colonoscopy in 1 year. It's completely preventable, and if the people are aware of that, once they reach that age, 50 years, let them ask their primary care provider, now what about the screening for the colon cancer?
I think what you said there is so important. This is completely preventable. So please get yourself screened. Dr. Adam, thank you so much. And to do that, all you have to do is call 209-564-3700 for an appointment. Once again, 209-564-3700. Dr. Adam said it. It is completely preventable. Get yourself screened. And if you want to learn more about colorectal cancer and colonoscopy, please visit dignityhealth.org. And if you like what you've heard, if you found this podcast helpful, please share it on your social channels and be sure to check out the full podcast library for topics of interest to you. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.